This video is a continuation of skin and eye infection. So MRSA is methicillin-resistant Staphylococcus aureus. It actually is a type of Staph aureus that produces what we call a beta-lactamase or penicillinase, which can actually break down the beta-lactam ring. And what that does is it makes the bacteria then, because it can break down penicillin, it makes it resistant to penicillin and methicillin. So methicillin was first used in the 1950s. And it turns out, guys, that it didn't take long before we were starting to see different types of resistance to it. Now, the treatment for MRSA is vancomycin, rifampin, tetracyclines. However, what we're seeing now is we're seeing vancomycin intermediate. I talked about that in lecture and lab with you guys, types of Staph aureus as well as vancomycin resistant types. So again, good hand washing, okay? And always take good aseptic techniques into consideration to prevent MRSA. So another type of staph infection is called scalded skin syndrome. And if you guys take a look at this baby here, look at how the skin is peeling and how red the skin is around it. And again, it actually looks as if the child has been scalded, but that's actually from the infection itself. There's a lot of different types of virulence factors out there, guys, that not only staph, but also Streptococcus pyogenes possess. And group A strep is one of those that has a very diverse number of virulence factors. They're all listed here for you to take a look at when you get a chance. So please know that Streptococcus pyogenes, S. pyogenes, can cause what's called necrotizing fasciitis or flesh-eating disease. Here's a good example. Look at how the skin is dying or dead, all these purple marks, the skin's peeling off, etc. And there's usually about 600 to 850 cases of this per year. Another type of infection is caused by what's known as Pseudomonas. These are gram-negative rods. They are part of our normal microbiota. These happen to be obligate aerobes, so they require oxygen to grow. Now, sometimes you'll find them in soil, sometimes in water, and they can also be found on plants. And sometimes, if you guys have ever seen kind of like a slimy biofilm in your vase, water, that could be caused by Pseudomonas. Now, right now with Pseudomonas, it does cause a lot of hospital-acquired infections. It's opportunistic, so if for whatever reason you are immunosuppressed, this shows up a lot in people who have some kind of immunocompromisation, and in cystic fibrosis patients as well. It forms biofilms. It can be found in indwelling devices. This is fairly common in cystic fibrosis patients, where you actually sometimes see a biofilm with Pseudomonas and Staph aureus. So again, about 60% of burn patients will develop Pseudomonas aeruginosa infection. So please know for your exam, guys, that some P. aeruginosa strains make piocyanin, and I'd like you to look at the bottom of this person's foot. Yes, the infection ate right through down to the bone, and this is the pigment that it produces. You get this really weird green color as a result of the infection. Also, please take a screenshot of this and upload it to the Dropbox. So this is a slide you want to take a screenshot of to upload to the Dropbox. So gangrene is a disease where blood vessels are damaged and you decrease the blood flow. Look at how the toes are starting to turn black. Very inflamed here. You can see over here you've got spots there, redness, etc. Necrosis is occurring. That's tissue death that you'll see. Now, we can have fungal infections of the skin too, and you can get those in, that are what we call cutaneous, and they're just superficial. And a lot of the fungal infections, guys, are caused by Candida albicans. Dermatophytes are also common as well. These will cause skin, hair, and nail infections, and they'll become brittle and flaky. So vocabulary word to know, guys, dermatophyte, I asked you to know this for the first exam. That is a collection of fungal organisms that cause conditions of the skin, hair, and nails. So it's a lot of different ones that can cause infections or disease in skin, hair, and nails. Please know for the most common types of yeast infections in humans, Candida albicans is the cause. This is the one that will cause vaginal infections in females quite often. Another type of fungal infection, guys, is ringworm. And ringworm, guys, is caused by microbes that we call Tinea, or we will say that depending on the type of infection where it's located, it's Tinea capitis, which would be your head, etc. The Latin name actually does mean worm, guys, because originally people thought by looking at these infections that they were caused by worms, but they're actually fungal in nature. So again, guys, Tinea, and depending on where the infection is, the second name tells you that. And here is a really good example. If you take a look, guys, you can see the ring that's coming around here. When people first studied this, they thought that there was a worm actually under there, but as you now know, that's actually a fungus. Athlete's foot, and you can take a look at the peeling and inflammation, a little bit of yellow discharge here. So athlete's foot is also an example of ringworm. Leishmaniasis, this one is actually caused by what we call a protozoa, and believe it or not, it's believed that this microbe causes anywhere from 700,000 to 1.2 million cases a year, infects people's skin. And here's a good example. If you guys take a look, this is usually painless. It looks like it would hurt, guys. But if you look around the edges, what you should see is this really is eating into the skin. It's really eating into the skin, and it does quite often cause permanent damage or scarring and can lead to other types of infections as well. When it comes to the eyes and infections of the eyes, there are several different types of microbes that can infect your eyes. Please know that the defenses of the eyes are lysozyme, which breaks down bacterial cell walls. Know that for your test. Also, lactoferrin, which binds up free oxygen. So both of these are important for you to know for your final, guys. These are defenses of the eye. So there's a lot of different microbes, as I said before, that can cause it. People that wear contacts have to be very careful. If you're using reusable, clean them very well. Everything has to be aseptic. Don't just clean them with tap water. Conjunctivitis is inflammation of the conjunctiva. And depending on how bad it gets, here's the way, guys, you can tell the difference between viral and bacterial. If you look in the virus, you see a lot of redness here all around, but in the bacterial, do you see like the pus that's oozing out over here? Yeah, that's indicative then of bacterial infection. So please know this, According to the CDC, trachoma is the leading cause of preventable microbial blindness. It's estimated, guys, that worldwide about 6 million people are blind due to trachoma. Now, WHO has targeted this treatable infection for elimination by 2020, by this year. I think you would agree that we have other things that we're looking for eliminating right now in 2020, but this is certainly on the list of things that need to be eliminated at some point. Please know what causes this is the microbe Chlamydia trachomatis, and there's a lot of different ones out there. A lot of times when people think chlamydia, they think of a STD, but it can affect the eyes as well. Take a look here, guys. The eyelashes and eyelids will start to turn inward and scratch the eye. If you take a look here, you can see the damage that's done underneath the eyelid as well. Another very bad type of eye infection is called keratitis, and that is a severe inflammation of the cornea. And you guys, I hope, are aware that the cornea is kind of like the outer layer there of your eye that looks out. It's a protective layer, and if that gets destroyed, you could most certainly go blind. Now, river blindness is one that only affects Africa, but look at how many people are infected, guys. 25 million people get infected. About 300,000 of these will be blinded by the larval state, so that's like the early stage guys, and 800,000 will become visually impaired. So this is the second leading cause then of infectious blindness. And this person here, if you take a look, how red the eyes are, there's some cloudiness on the iris and of the cornea here. A very bad situation, a lot of nerve damage and optic and corneal damage here.